గుడ్ మార్నింగ్. హెల్త్ అవేర్నెస్లో భాగంగా ఈరోజు వీఆర్ గోయింగ్ టు డీల్ విత్ నాన్ కమ్యూనికేబుల్ డిసీజెస్ లైక్ నాన్ కమ్యూనికేబుల్ డిసీజెస్, diseases that cannot not be spread from person to person. Example, cancer, heart disease, cirrhosis, like that. Which are communicable, like infectious diseases, which are communicable, but non-communicable. If you touch also, it won't communicate. If you sit by the person, it won't communicate. If you share the bed, it won't communicate. If you eat together, it won't communicate. Those are called non-communicable diseases. With long duration also not, and according to age, these are divided into two groups, like in the younger age group and elder age group. Younger age group, like accidents and injuries, rheumatic heart disease, diabetes, blindness, psychiatric disease. Elder age group, hypertension, coronary heart disease, diabetes mellitus, stroke, malignancies, obesity, blindness, psychiatric disorders, other and respiratory disorders. We are going to deal with one by one today, if possible in the same video, or otherwise we'll continue the second video. What are the risk factors? Those are two types of risk factors, like non-modifiable risk factors and modifiable risk factors. Modifiable means which can modify by the person, like environment modified, like addictions, cigarette smoking, alcohol, and dyslipidemia, sedentary lifestyle, and stress, and inability to avail preventive healthcare services. These are the things which can modify yourself, like stop smoking, stop alcohol, stop exposure to dust. Like these are the things. And non-modifiable. Something we cannot modify, like age we cannot modify, no. Sex we cannot modify, and family history we cannot modify, genetic history, and we cannot modify, personality cannot modify. What are the causes and risk factors for non-communicable diseases? Like one is unhealthy diet. If you eat unhealthy diet, definitely you are prone for the adulterated food and carcinogenic added in the food, preservatives. Those may lead to cancers. So tobacco use, there are a lot of complications with the tobacco use, like respiratory problems and cancers issues, and physical inactivity. Physical inactivity also sedentary life, which leads to obesity and which leads to diabetes and hypertension, which leads to stress and overweight, obese, and genetics. Genetics also, genetically, if you are transmitted the disease, you cannot modify. They are the one of the causative factor. Alcohol, it is also one of the causative factor, and environmental factors. According to risk factor classification, there are three types: background risk factors, behavioral risk factors, and intermediate risk factors. Background risk factors. What are the background risk factors? Now I am going to explain. Age, sex, level of education, and genetic composition. And cannot these are the things cannot be changed. And behavioral risk factors: tobacco and alcohol, unhealthy diet, and physical inactivity. These can be modified. Intermediate risk factors: elevated blood lipids, diabetes, high blood pressure, and overweight or obesity can be controlled. Some of the things which cannot be modified, some of the things which can be modified, some of the things which can be controlled. And now I am going to explain about the cardiovascular diseases. Those are non-communicable diseases. One is cardiovascular disease, like caused by disorders of the heart and blood vessels, which includes coronary heart disease, cerebrovascular disease, stroke, raised blood pressure, hypertension, peripheral arterial disease, rheumatic heart disease, congenital heart disease, and heart failure. Although heart attacks and strokes are major killers in all parts of the world, 80% of premature deaths from these causes can be avoided by controlling the main risk factor, like tobacco, unhealthy diets, and physical inactivity. Cardiovascular risk contributory factors: genetic makeup of a person, lifestyle habits at early age, socioeconomic status, mental health, diet, overweight and obesity, occupation, smoking, alcohol abuse, diabetes, and urbanization. They are the contributing factors for cardiovascular disease. Cardiovascular prevention. How do we prevent? Maintain a healthy lifestyle habits, focusing on a combination of risk factors for cardiovascular disease, Regular medical screening for individual at risk. After 40 years of the age of the person, you have to go for every year. You have to thoroughly go for the cardiologic checkup, like 2D echo, ECG, stress ECG, treadmill, regular medical screening, providing effective and affordable treatment to those who require it to avoid further complications. Like we are having lot of the facilities nowadays where government is providing like Arogyasri and Ayushman Bhava, and insurance you have to avail the health insurance policies. By those things, you have to go for regular checkups and modify the modifiable factors like tobacco, alcohol, and drugs, which are environmental factors, which are sedentary. These can be modified, and by taking precautions. And if you like diagnosed at the early stage, which can be preventable. There are so many preventable deaths like myocardial infarction, cerebrovascular disease like strokes, paralysis, huh? And next communicable disease like cancer. Cancer is the abnormal growth and spread of the cells that arise from a change in one single cell. The change may be started by external agents and inherited genetic factors and can affect almost any part of the body. The transformation from a normal cell into a tumor cell is a multi-stage process where growths often invade surrounding tissues and can metastasize to distant sites. Cancer cell, the abnormal growth of the cells leads to accumulation of the number of cells, which can cause local pressure effects and local destruction of other cells, and they absorb the nutrients from the other cells, and it may spread to the other areas also. Those are the things which can be caused by genetic factors and environmental factors also. Environmental like tobacco and alcohol like factors. Physical carcinogens. These are the causes. What are the causes of the cancer? Physical carcinogens, chemical carcinogens, biological carcinogens. We can divide it into three stages: physical, chemical, and biological. Physical, like such as ultraviolet and ionizing radiation or asbestosis. Chemical carcinogens, such as what are the chemicals? Vinyl chloride, beta-naphthalene, both rated by International Agency for Research in Cancer as carcinogens. Like one is vinyl chloride and beta-naphthalene. They are the chemicals, and arsenic. And those are the carcinogens like vinyl chloride and beta-naphthalene are components of tobacco smoke. So you can, if you avoid carcin, cancer will be reduced. Aflatoxin, food contamination, and biological carcinogens such as infections from certain viruses, bacteria, or parasites. What are the major organs which are affected? Lung, breast, colorectal, stomach, and liver cancer. In high income countries, the leading causes of cancer deaths are lung cancer among men and breast cancer among women. What are the common causes of cancer? Common cancers in men, lung cancer. In women, breast cancer. In low and middle age, in India, cervical cancer for women. In low and middle income countries, cancer level varying according to the prevailing underlying risk. In sub-Saharan Africa, for example, cervical cancer is the leading cause in women. Poor countries, cervical cancer. Middle and higher income group producing group countries, breast cancer in women. In men, lung cancers. Cancer risk factors like tobacco, unhealthy diet, insufficient physical activity, the harmful use of alcohol, infections like hepatitis B, hepatitis C, liver cancer, human papillomavirus, Helicobacter pylori, radiation, and variety of environmental and occupational exposure of varying importance. Diseases and other diseases like respiratory diseases like asthma, COPD, lung cancer, and second hand smoke causes severe respiratory health problems in children such as asthma and reducing lung infections, reduced lung functions, and asthma is now the most common chronic disease among children throughout the region. We will discuss other communicable diseases in next group. Thank you, thank you, thank you.